Good morning, everyone. As we begin a new month in St. Louis County, we hope that May is a month that we can continue our discussion about a gradual reopening of St. Louis County. By the end of next week, I'll certainly have more information in that regard. We're having those discussions now among our regional leaders. Governor Parson has announced that he will lift the stay-at-home order in the state of Missouri with some additional restrictions starting on May 4th. And I understand that other areas of the state, other counties who are not as impacted as St. Louis County will be following the governor's plan. He has also made it clear to us that St. Louis County is not like the rest of the state, and he understands that local leaders here may be on a different timetable. St. Louis County is not ready to release its safety orders, its stay-at-home restrictions, although we are in discussions of that timeline right now. St. Louis County has over 40% of the positive COVID-19 cases in the state. We still have a lot of people who are very sick in our hospitals. I know this process has kept a tight grip on our economy, and I understand the impacts nationally and here in our region have been devastating. We understand that, and we're going to move through that. Today, in response to that, I'm pleased to announce our St. Louis County Cares Small Business Relief Program. This SBR program will focus on economic relief to the businesses that have been most impacted by the stay-at-home orders and the epidemic. This grant can be used to pay the cost of business interruption or reopening costs to become in compliance with new social distancing guidelines and to get these businesses open again and contributing to our economy. So again, the business interruption costs can include any fixed costs, utilities, or costs associated with social distancing changes in the place of employment. Businesses eligible for an SBR grant include nonprofits, sole proprietorship, for-profits, anyone who has any business that has a place in St. Louis County as its principal place of business, 50 or fewer full-time employees as of March 1st. These guidelines were based on preliminary research by the Federal Reserve Bank of St. Louis, which has shown us that the businesses most impacted by our stay-at-home orders are businesses with 50 employees or less. The Fed will be releasing the results of their survey later on today for more details about their findings. The SBR program will total $2.5 million per county council district. This in total will be about $17.5 million, which represents about 10% of the CARES Act grant from the federal government to St. Louis County. This one-time grant program will provide up to $15,000 for eligible reimbursements per business. No one who is a director, an officer, or an employee of a business who is an elected or appointed official of St. Louis County or any municipality in St. Louis County will be eligible to receive grant funding. In consideration on whether or not a grant should be awarded, we would also require that no business could be discriminated against based on race, creed, color, sexual orientation, gender identity, marital status, disability, or any other unlawful basis. A business is considered to be in good standing with St. Louis County if they are in compliance with our stay-at-home order, and there is no complaints of retaliation for anyone who reported anyone not being in compliance with our stay-at-home orders. A nonprofit organization that is a place of worship will not be excluded from receiving grant funds if they, for the sole reason that they are a place of worship. And they must comply for the other measures as well. The process for all of this, the goal of all of this with our SBR grants really is to focus on the businesses that have the most financial need in our community. And we believe that We need the help of our elected officials who are closest to these businesses, closest to the community, to help us make those judgments. So these grants will be awarded based on the recommendation of the council member from each district, but also recommendations of mayors, if appropriate, in any municipality that represents a business who has applied for one of these grants. Each county council member will summarize all of their recommendations by June 1st, and those will be reported to an independent accounting firm that we will identify, who will make a summary of these recommendations and will certify that they are in compliance with the grant programming. The accounting firm recommendations will be reported to the county executive's office through our process and also to the county council's oversight committee. We'll also ask the county accounting firm, in addition to certifying compliance with our grant program, to also summarize any applications that were not recommended and any categories for which they were not recommended, any reasoning why. If the recommendations of each council district exceed the award amount, the total budget for these awards, then we will ask the accounting firm to adjust the applications appropriately to stay within budget. Also, any awards, any applications are all public information. All these applications are public documents. The process, the recommendations, and the applications will be reported on our transparency portal at stlcorona.com. We all recognize that we're really dealing with three crises here. We're dealing with our health crisis, our humanitarian crisis, and our economic crisis. We will remain focused on saving lives, but as we move forward, we want to start the process as quickly as possible to start getting some of these federal stimulus funds into the hands of our most affected businesses, as we've been helped with that identification through the Federal Reserve Bank of St. Louis, but also our local elected officials who are closer to each community. With the County Council's help, we believe that we can move over the month of May, by June 1st, be in process of moving $17.5 million of this federal stimulus grant into our community, into the businesses that have been affected the most. We hope to have more information regarding this up on our website this morning, stlcorona.com, and by the end of the day, we believe we can have an application up as well, so we can start this process in St. Louis County. And I'd be glad to answer any questions.
Real quick,
yes.
You mentioned the $73 million for small business. I was given a question saying that really only 10% of that money was going to be allocated specifically for small business. Is some of this money going to go for testing?
Our primary focus with response has always been the public health piece. We've already had bids out for testing. Our testing supplies are improving. We have an enormous interest in selling testing supplies to St. Louis County, and we're going to continue that process. This is $17.5 million, is about 10% of the federal CARE grant award to St. Louis County.
And a follow-up to that question. People will be tested, but that doesn't necessarily mean from a month from now that they're not possibly going to catch the virus. So spending a large amount of money, of this money, on the testing at the point where everyone could possibly already have some sort of infection, is it necessarily good money after a bad situation?
I don't understand your question.
What I'm saying is, you can test today as if you don't have the virus, right, and tomorrow you catch it, or
right.
You know, the point I'm making is you're going to have to retest people multiple times over how long of a period? 6 months, a year?
Well, we would test anyone who develops symptoms. They would be tested. The St. Louis County will purchase tests and try and participate in that test. The federal government has indicated that insurance products should be paying for the test for people who have insurance. So St. Louis County will not be the only source of funding for tests in our community, but we need to buy testing supplies, and we need to be in this space along with everyone else. Our health systems, our federal qualified health centers, there are private labs who are providing testing. St. Louis County Department of Public Health is primarily responsible for following up on those test results, doing the contact tracing, advising people who've been exposed to someone who has a positive test, advising them on symptoms and quarantine, and also helping to advise anyone who's had a positive test on how they should take care of themselves.
So I'm looking at the timetable says that you're announcing it today, and then you're gonna give the council members recommendation forms on the 15th, and then they have to turn in the forms by June 1st. And I imagine that if they turn in the forms on June 1st, there's gonna be another period of time where you're gonna have to review, decide whether to do this. Now, some people may say, that's too long of a timeline, and that's not a speedy enough transmission to get businesses this money. What would you say to that this may not come in time to save some of these businesses from going out of business?
I would say that I've always said that this is an emergency, and that's why moving this money through the council is so important. They appropriated the funds 3 days ago, and we're announcing the program within 72 hours of that appropriation. We've been working on these details now for a couple of weeks. We've been talking about this for a couple of weeks since the Federal CARES Act was passed in Congress. I asked my staff immediately to look at what sort of relief we could have for small businesses, and this was one of their recommendations. I understand that there is a process and there is a timeline. This is about as fast as we can responsibly move to allow people to apply, to give the council members time to thoughtfully review these applications, to give mayors of cities to thoughtfully review these applications. I've always considered our municipal elected officials as part of our team that represents the interest of the residents in St. Louis County, and that's why I would like for them to be a part of this process. They're much closer to the businesses in their communities than we are here in St. Louis County government, and so are the council members. So there will be a timeline, there will be a process. The process has to be responsible and thoughtful and urgent, and we think this strikes the right balance.
And a follow-up question to that. After your administration decides whether to approve or deny certain businesses, it doesn't have to go to the county council again to be approved. It would be, now the decision would be made, and then businesses would either get the money or wouldn't get the money.
Yeah, so, this is an emergency situation. So the process that I've advocated for, the process we see usually, certainly at the state level, the process that they have initiated is to appropriate the funds, put it in the proper place, and then start an urgent and responsible and transparent process to get it into the community that incorporates the opinions of everyone that should be involved in the decision. And that's what we're doing here. I certainly believe very strongly in the contributions of the council members. That's why I've asked them to be involved so deeply in this process. Taking it back to the council again would add more time, as you mentioned, and could also interfere with the arrival of this money into the hands of the people who need it. But that doesn't mean the council members or other elected officials aren't deeply ingrained in the decision-making of how we help people as quickly as possible.
So what about this money in your mind or this program is so critical? Is this an important part of moving the economy forward when this gets going again? Or what do you see as so critical here in this?
Well, the most important thing in getting our economy moving forward is a strong public health strategy that controls the spread of coronavirus in our community, because all of the economic impact on our region has been due to these measures that we had to initiate to save lives. And we always had an eye on the economic impact. We're watching it very closely. I've asked my staff to watch it very closely. And we believe that this will be meaningful. It won't solve all of the problems. There's still going to be stress in our region, but we've used our resources to identify the businesses that we believe are most stressed, businesses under 50 employees who were impacted by the stay-at-home order directly.
What about this do you find to be the most critical? Just accessing the ability of these businesses to get funds, or what about this is so critical?
Well, any business that has access to other federal relief programs would be ineligible for our programs. We're trying to get some funds in the hands of businesses that would be helpful. We will not solve all of their problems. We believe this will help some. What will help them as much as anything is controlling the spread of coronavirus in our community in a responsible way and creating the right environment for them to get open again with good social distancing guidelines so their employees do not become infected with coronavirus and their customers do not become infected when they visit these places of business.
As on another topic, your reaction to the change in course by Sean Flower out in Eureka not to reopen on Monday?
You know, that whole conversation is just an expression of the frustration of the stay-at-home orders, and it's expressed in many different ways in our community. And I think he's speaking up for his unique situation where he is represents a city that is in 2 counties and causes particular difficulties. I think everyone understands we have 88 municipalities in St. Louis County. The public health orders is a jurisdiction and a responsibility of county government. That's where that responsibility lies. There's a lot of reasons why individual businesses wouldn't want to go against that health order, and you know, that's just the way it is. I think the most important thing is that we find a path forward. We focus less on our differences of opinion. We respect people who disagree with us. We come up with a way to get our businesses open again and to responsibly manage the spread of the COVID-19 virus in our community. Our role in county government is to protect the health and welfare of the residents of St. Louis County. We're going to stay focused on that, always watching the other pieces of this crisis, the humanitarian piece and the economic piece.
Clearly, I'm presuming that you think that was the right thing to do on his part, though.
Well, sure, it's the right thing to do to follow the county's stay-at-home orders, work with all of us in a cooperative way to try and get people back to work and to protect the health and safety of everyone in the county.
And finally, the Republican members in the council put out this reopening plan yesterday. You obviously met with them.
Mm-hmm.
Your thoughts on that proposal? Is there validity there? Is it too soon? What's your thoughts on that?
No, I think they had some good ideas. They're very similar to some of the things that we're doing. And I asked my staff to take their report and study the details and see if it would modify anything we're already doing. We certainly disagree on the timeline. They've expressed their timeline. Our timeline is different. We are different than the rest of the state. As I said before, we have the highest impact of COVID-19 in the state is right here in St. Louis County. We still have a lot of people who are very sick. We still have a lot of people in our hospitals.
Just a follow-up to Chris's question. With the adjoining counties and the city, their view of reopening and so forth, I mean, are you trying to work with the mayor at all in
Yeah.
any way to
Yeah, I
bless this
spoke to the mayor yesterday. We believe that we will have reopening plans that are very similar. We believe we'll have timelines that are very similar. We're going to be working together as we have been. Our COVID-19 impact is very similar. St. Louis County is affected, just like St. Louis County is. The St. Louis County, St. Louis City together make up about 60% of the cases in the state.
Just a logistical question. I was reading through this. On this grant, do the businesses apply? Do they have to apply with their council member and then get a recommendation from that council member? Just kind of logistically, how does
They'll
that work?
apply online.
Right.
The council member will make the final list. And we would also ask that mayors of municipalities that have affected businesses will also make a recommendation. The council member may seek advice from other places. But in addition, in the final piece of this, I believe the council members are closer to their communities. They know their businesses better. They'll be able to evaluate the needs and the applications. And I would like for them to be involved in this process.
So do the council members make the decisions for who gets the funds in their respective districts?
They will make recommendations. They will have to follow the guidelines of the program when they make those recommendations. They will help us understand the need, but all of the applications for funding have to follow the program guidelines. And those guidelines will be available in more detail on our stlcorona.com webpage.
So they make recommendations to you and you make the final decision?
Well, they'll make recommendations to the accounting firm. The accounting firm will certify that these programs are eligible. But my intent is to follow the recommendations of the council members as long as they stay in their budget and their recommendations are within the boundaries of the program.
So you mentioned that you've been talking with Mayor Cruz and other regional leaders,
Mhm.
and you may have more information about a reopening plan next week. I just want to make sure that I heard that correctly.
Yes, that's right. Yeah, we've been talking about this for some time. We talk about it all the time. We recognize the frustration in our community, but we also recognize that St. Louis County was hit much harder than the rest of the state. The majority of COVID-19 infections in the whole state of Missouri are right here in St. Louis County, and our hospitals still have a lot of patience. We believe the trend is going the right way, and we believe now is the time to talk about that plan and talk about that reopening strategy.
This is a more far-field, long-term question. In addition to Senator Josh Hawley, there's been some Democratic senators who've been proposing a plan that would have the federal government subsidize a major portion of salaries of employees that are affected negatively by COVID-19. I don't think it's going to pass anytime soon, like now, but it could pass eventually and be in place for the fall if there is like a surge. So my question for you is, as someone who has to put these stay-at-home orders in place, do you think a plan like that would make it easier for you to take direct action and also make some stay-at-home orders like what you're doing more agreeable to the public if they knew that their jobs were going to be preserved by that type of program?
Well, there certainly is a vocal group of people that are pushing back against the stay-at-home orders, and they tend to be the individuals that are most adversely affected. And I understand that. But underneath all of that, there's still a lot of people who are adversely affected who want to be safe. And they want to do what's smart, and they understand that a few weeks of sacrifice will save us all in the long term. So there's a wide spectrum of belief. The important public health strategy about what's being discussed at the federal government, the important part of that is that someone who is sick does not need to have a financial incentive to go to work and expose other people. So that is not so much about compliance with the stay-at-home order, but individual behavior, because really, as we begin to ease our social distancing restrictions, really what keeps us safe moving forward as a community is individual decisions that are made about social distancing. What's happening in a place of business? What are they doing to protect themselves? What are they doing to protect their customers from employees? That whole social distancing around a business is very important, how people react in public. Those decisions, a decision to go to work when you're sick is a terrible decision. And you don't want an individual to be financially motivated to have to go to work. And that cuts against the grain of everything we're trying to do. If someone is COVID-19 positive, they need to be tested, they need to recover safely at home and move past it and then get back to their lives. And anyone they come in contact with has to be found, advised, and if necessary, quarantined or protected from exposure. But at least advised to know that they're at risk. And that testing, isolation, contact tracking, tracing, and advising is the fundamental piece of this public health strategy. So you don't want someone to be incentivized to go to work when they're sick. And that's one of the pieces of this. And that's why immediately a lot of our employers who could do so changed their absentee policy. We did in St. Louis County right away. And we said, if you're sick from COVID-19, it won't count against your sick time. We will try and protect you and keep you whole as much as possible, because we don't want you at work if you are COVID-19 positive or have the symptoms of COVID-19.
On the reopening strategy next week, do you anticipate putting out a date for reopening next week, or are you still looking at mid?
I think we'll put a timeline. We should be able to release a timeline by next week for sure.
But still not before mid-May?
Mid-May has always been our target to reevaluate where we are. That's what I've said, that's what the mayor said, and I think that remains the same.
Is one aspect that you and Mayor Creason are discussing, like how summer camps are going to be affected by the rejiggered stay-at-home orders? I mean, obviously this personally affects parents like me, but I think a lot of people are wondering, like, if there's still restrictions in place, if summer camps have to be canceled, that's going to make it a lot harder for a lot of people to go back to work, even especially when their employers are like, you have to be physically in our office, but you don't have childcare. So is that something that's being discussed?
Yeah, there are many, many challenges as we begin to change our social distancing policy and our orders in the community. One of them is childcare. One of them is childcare in a congregate setting or group setting. And we are going to have some advice in that regard. We don't know yet where we're going to be as a community. We'll look at our testing capability in a few weeks. We'll look at our hospitalization trends in a couple of weeks, and we'll see where we are, and we could provide more guidance on running camps, daycares, child care operations, And as we get into the fall schools, we'll provide more guidance on that. We just don't have the information to make those recommendations today, but we might have better information in 2 or 3 weeks to provide that guidance. I know our virtual schools are going to be out soon, and as people start to go back to work, as our residents who are in non-essential businesses start to change the way their lives work, that there's going to be some movement in child care. We understand that. All of this is always going to be through the lens of keeping people safe and protecting their health. But that does not mean we disregard the economic impact. We have to find that balance.
Chris, Jason, you all good?
Okay, thank you.